Madam President, I would like to pick up where my colleague from Tennessee left off and talk a little bit about this issue that's before us, that's before the country right now, the issue of health care reform. And I would submit to my colleagues in the Senate that the purpose of reform, as has been stated now for many years as reform has been talked about, is we've got to do something to get health care costs under control. We've got to rein in these increasing double-digit every year inflationary increases that people are seeing in their health care costs. And so the purpose of health care reform, as stated, is to lower the costs of health care for people in this country and also to extend coverage, provide access to coverage for those who don't currently have it, which, as has been noted in the past, is about 15% of the population. About 85% of people in this country do have health care, and their concern is, what are we going to do to drive down the cost of health care? What are we going to do to make my insurance cost less and my health care coverage cost less? And in that vein, I would like to point out an article yesterday in the Wall Street Journal, which I would recommend to my colleagues, which was written by former CBO Director Douglas Holz-Eakin. And in that article, and I'd like to, as I said, ask unanimous consent that be entered into the record. Thank you, Madam Chair. But I'd like to highlight a few sentences of from that article that was regarding the bill that was reported out of the Finance Committee earlier this week. And in that article, he says this, and I quote, "The bill would impose nearly $400 billion in new taxes and fees. Nearly 90% of that burden will be shouldered by those making $200,000 or less. It might not appear that way at first because the dollars are collected via a 40% tax on sales of by insurers of, quote, Cadillac policies, fees on health insurers, drug companies, and device manufacturers. But the economics are clear. These costs will be passed on to consumers by either directly raising insurance premiums or by fueling higher health care costs that inevitably lead to higher premiums," end quote. In addition, Mr. Holz-Eakin takes fun. I'd be happy to yield to my colleague from Arizona.
As my understanding of the proposal, this reform will begin to be implemented in what year?
I believe the answer to that question, I might say through the chair, is 2013, 2014. 2013,
2014. But when do the taxes that would supposedly implement this proposal kick in?
The taxes, I would say to my colleague, again through the chair, kick in immediately. You get the revenues starting to come in right away. So the revenues are front-loaded, the costs of the program are back-loaded. So it understates and distorts what this program, this new proposal, will cost.
So we have 10 years' worth of tax increases to pay for 5.5 years of the implementation of this so-called reform. Then what are the implications in the future?
Well, that's clearly the case. If you look at the 10-year cost of this, because the revenues, the tax increases are front-loaded, and we get to see basically 10 years of tax increases and only about 5.5 years of actual implementation of the program. What you have to do to get a full picture of what the cost of this program will be is take the fully implemented cost. If you take the fully implemented cost, I would say to my colleague from Arizona, you're looking not at the $829 billion that was reported by the CBO because of this distortion and this creation of a revenue source before the costs kick in. You're looking at a $1.8 trillion new entitlement program fully implemented over a 10-year period.
One more question for my colleague. Is there any provision in the legislation, as you have seen it, that has any whatsoever approach to medical malpractice reform or medical liability reform, which in the view of many experts could be as much as $100 to $200 billion a year?
There is not. I would say again to my colleague from Arizona.
Isn't that incredible?
I think it is incredible because it's now validated by the Congressional Budget Office that if you were to incorporate that, you would drive down the cost of health care in this country by literally billions and billions of dollars, and yet there is no mention or reference to a medical malpractice.
But also, isn't it true, as much as we respect the Congressional Budget Office, their figures as the amount of money that can be saved by implementing meaningful medical malpractice reform, such as the case in the state of Texas, that it doesn't not only reduce the costs as far as litigation is concerned, But I don't believe that it's calculated using the way they calculate costs, the incredible increase in healthcare costs associated with the practice of defensive medicine. The doctors prescribing unneeded, unnecessary, and many times, because of the nature of the procedure, unwanted additional tests and procedures, because that physician is practicing what we call defensive medicine, which is the fear of finding themselves in court, and not only because of the increasing premiums for medical malpractice, but also obviously the time, the effort, the energy, and all the things, including damage to reputation that could accrue from a lawsuit brought against that physician.
My understanding is the Congressional Budget Office does not only contemplates the cost of litigation, does not take into consideration the cost of the practice of defensive medicine, which, as the senator from Arizona has noted, is an enormous cost, additional cost, and many estimates that have been done, independent estimates, suggest $100 billion to $200 billion annually. And I also might add that the Congressional Budget Office study only took into consideration government health care, so it didn't include the private health care delivery in this country. But many physicians, as you've noted, practice defensive medicine because they are worried about being sued. And so all these duplicative tests and additional practices that are undertaken by doctors in this country to avoid the lawsuit potential or the risk that they incur when they practice medicine in this country add significantly, and as I said, as independent estimates have suggested, to the tune of $100 billion to $200 billion annually to the cost.
Finally, could I ask, isn't it absolutely incredible that in the name of reducing health care costs and the burden that rising health care costs impose on every American family, that there should not be one provision, one meaningful provision for medical liability reform, which is, in the judgment of any objective observer, except maybe the trial lawyers, if you're something that must be implemented if you're going to have a serious effort at reducing the cost of health care in America.
Absolutely, and I think that in a moment of honesty, Howard Dean said recently that the reason that medical malpractice reform is not included in any of these pieces of legislation is that they didn't want to take on the trial lawyers. And it seems to me, at least, that you can't have a meaningful discussion about lowering health care costs in this country absent the inclusion of this issue, this important issue of the practice of defensive medicine, which is tied directly to medical malpractice lawsuits in this country, and the desperate need, I think, that we have for reform in that area.
I thank my colleague.
Madam Chair, I would just simply, and again, as the senator from Arizona has noted, an important component of this debate, which is a cost driver, which actually is not, it leads to higher premiums, leads to higher health care costs, both in government health care, Medicare, Medicaid, but also in private health care delivery. And despite all the promises that the President has made to the contrary, there isn't anything in these bills to date, according to the Congressional Budget Office, that drives the cost curve down. And in fact, what we're looking at is higher health care costs attributable to the many of the provisions in these bills. And I want to point out, and it's interesting to note, because during the hearings, the director of the CBO, Doug Elmenhorf, the current director, I mentioned earlier Douglas Holt-Zekin, whose article I referred, he's a former CBO director, but the current CBO director, Doug Elmendorf, repeatedly admitted that he'd not had the opportunity to find answers to some of the important questions in this debate. CBO told us that increased taxes would be passed on in the form of higher premiums. He did tell us that, generally dollar for dollar. But when he was asked if CBO had calculated how much insurance premiums will rise for Americans who already have coverage, he said no. Asked if they'd looked at whether total spending on health care would go up or down, he said no. Asked if they looked at how the bill would affect access to health care, he said no. Because of the way the bill's been constructed, with so many holes and so many real and no real legislative language, and because of the way it's been rushed through, there simply has not been time, evidently, for CBO to look at this and to know for certain what some of these impacts are going to be. And I have to ask, would Americans buy a health care plan without knowing how much it costs? Does anybody in this country really look at buying a health care plan without knowing its cost? Well, that's exactly what the Democrats here are doing with this bill, buying a national health care plan without any idea about how much it's going to cost the nation or individual taxpayers. Now, we do know that the plan is going to bring us higher taxes, higher premiums, and cuts in Medicare. I think that's a fair assessment, and there are two studies in this last week, independent analyses, verifying that premiums are going to go up. And I'd like to point out one of those studies, which came out yesterday, an Oliver Wyman study, said that premiums will increase in the individual market approximately $1,500 for single coverage and $3,300 for family coverage annually. And that's exclusive of inflation. So the annual inflationary increases that we're seeing in medical expenses in this country are not included in that estimate, but $1,500 for an individual, $3,300 for family, annual increase in cost for coverage. Now, small employers who are purchasing new policies in the reform market are going to experience premium increases that are up to 19% higher. And this is in year 5 of reform. The other study that was done recently, the Price Waterhouse Coopers study, which has come out just a couple of days ago, also had some statistics, I think, that were very revealing and illustrated, too, that these costs, these premium costs that are going to be borne by the American people are going to go up and to go up significantly. And so you have two independent analyses that have been done here in the last week talking about how much premiums are going to go up. We know now with the Joint Tax Committee's assessment and CBO's assessment that taxes are going to go up. And we've said how the impact of that's going to fall. And I might add, if you look at where the biggest impact of the tax increases fall, families earning 150% of the federal poverty line, which is $32,200 in this country, will face an effective marginal tax rate of 59%. 90% or 89%, according to the CBO, of the tax increases would fall on earners making less than $200,000 a year. 71%, or 50%, I should say, would fall on those making less than $100,000 a year. So you've got average Americans out there trying to keep up with the cost of health care along with the cost of everything else in their lives who are going to be hit with higher taxes, higher premiums, and our senior population is going to be hit with higher Medicare premiums because Medicare is going to be cut. It's going to have an impact on Medicare Advantage programs. It's going to have an impact on providers across this country. The things that we know for certain about this bill is it's going to spend $1.8 trillion when it's fully implemented, over a 10-year fully implemented time frame. It's going to leave 25 million people without coverage. It is going to raise premiums for people in this country, and it is going to raise taxes on people in this country, particularly those who make under $100,000 a year. Half of the tax burden will fall on them, according to the Congressional Budget Office and the Joint Committee on Taxation. That's what we're looking at with this legislation, Madam President, and as much as is talked about health care reform and covering more people and lowering costs, at the end of the day, we're looking at higher premiums, higher taxes, cuts in Medicare. That's the bottom line. And that's why we as Republicans are looking for real solutions that do bend the cost curve down. And as the senator from Arizona has noted, one of those certainly would be throwing into this mix the issue of medical malpractice reform. I want to just point out a couple of statistics before I conclude here about how this would impact people in South Dakota according to one of these studies. In the South Dakota market, in the individual market, if you're buying in that market, you're going to see your premiums go up by 47%. If you're a family, you're going to see your premiums go up by 50%. And if you're in the small group market, you're going to see a 14% increase in premiums. And if you're an individual and for a family, 15%. So my state of South Dakota is not going to fare very well when it comes to the costs associated with this plan. And I would argue that most Americans, as they evaluate the impacts, the personal impacts of this health care reform proposal, they're going to give it a thumbs down. And hopefully we can go back to the drawing board, address this in the way that we should have in the first place, and that is step by step, not rushing to jam through this massive expansion, $1.8 trillion program with higher taxes, higher premiums, and cuts in Medicare.